Sleep apnea is a frequent reflexive gasping for air that awakens a person and disrupts sleep. Sleep apnea can be fatal. It can sometimes be caused by airway muscles relaxing and collapsing during sleep, causing upper airways to be blocked by excessive tissue.
A person can have anywhere to 100 to 200 of these a night. That would be considered a very severe case of obstructive sleep apnea. Even 5 to 20 awakenings a night, which would be considered a mild case of sleep apnea, is more than enough to disrupt a person's sleep and cause a number of issues during the day.
The most common device for patients with sleep apnea is called the CPAP. This device blows air into the nose through a mask and keeps the airways open. For more severe cases of sleep apnea, some patients need to get surgery.
Very simple head harness. It has 2 holes here for the nostrils to just put in the nostrils at night when you're sleeping, which forces air through the nostrils and again decreases the snoring while you're asleep at night, and again gives you a much better night's rest. It's just very simple. It's time to go to bed.
Some common symptoms of people with sleep apnea are depression, difficulty concentrating, dry mouth after awakening, excessive perspiration, excessive sleepiness during the day, nighttime urination, heartburn, high blood pressure, insomnia, loud snoring, morning headaches, obesity, and restless sleep. Somnambulism, or sleepwalking, occurs when a person arises and wanders about while remaining asleep. Sleepwalking is a series of complex behaviors that begins during slow-wave sleep. Sleepwalking can happen with other sleep conditions or alone. Some sleepwalking may just be sitting up, or it can be more severe and involves getting up and walking out of bed. Between 10 to 30% of children have experienced one episode of sleepwalking, but only 1 to 5 have a continuous problem. 1 to 7% of all men and women sleepwalk, and violent episodes are more likely to occur in adults. About 80% of sleepwalkers have relatives with problems, and first incidents of sleepwalking usually take place between 4 to 8 years of age. Some ways to help sleepwalking is to avoid alcohol and sedatives, don't go to bed with a full bladder, follow a relaxing bedtime ritual such as reading a book, and practicing good sleeping habits, because the more tired you are when you go to bed, the more likely you are to sleepwalk.
It might not be exactly correct behavior. It's not uncommon for sleepwalkers to do something atypical. An example would be instead of putting dirty dishes into a dishwasher, they're trying to put them away in the cupboard. And it's perfectly suitable to try and guide a sleepwalker back to bed. If you make a sleepwalker think they've completed their task, it looks clean now, I think you've done a good job, or hey, the dishes are all set. It sometimes will be a trigger for them in their mind to return to bed. Generally, a sleepwalker will return to bed once whatever this task may be is completed. It's totally okay to assist a sleepwalker. It's not even necessary to wake them up. Just guide them back to bed. And there's no need to be worried about their embarrassment, because they're more likely than not going to remember a thing of what happened the night before when the next morning comes. There's common misconceptions of a person walking with their arms straight out and their eyes closed, sort of in a zombie state. And that's really not an accurate depiction of what a sleepwalker looks like. There's also misconceptions of sleepwalkers being startled or terrified to the point of collapse or even death if they're awakened from their sleepwalk. That's not necessarily accurate either.
You should also make sure that your house is safe and keep doors locked, because although it is rare, sleepwalkers have been known to unlock doors, leading to injury and harm.
Narcolepsy is a disease marked by sudden and irresistible onsets of sleep during normal waking periods. Narcoleptics go directly from wakefulness to REM sleep. It may be accompanied by hallucinations and sleep paralysis. It may be caused by abnormality of brain mechanisms controlling REM sleep. Narcolepsy is one of the most common types of hyperinsomnia. It is a disabling sleep disorder that affects the control of sleep and wakefulness. Attacks can last from seconds to 30 minutes. During an attack, a person may experience cataplexy, which is sudden loss of muscle tone.
Hey Nathalie, what's up? Body sensei!
About 40% of sufferers have a history of other mental disorders. It usually starts with teens and worsens with age.
Nathalie, remember that one time we were in a cycling club and then we smashed all the bottles? And then it was so funny.
Ladies and gentlemen, I'm passing through a beautiful suburban home with a lovely plate glass window, which has not slowed me down in the least. I approach the king-size bed. I notice the phone is off the hook. I wonder if it's for me. As we leave this warm, friendly family atmosphere, I'm gaining altitude.